How to treat ingrown toenails, onychocryptosis, a comprehensive guide. Ingrown toenails, also known as onychocryptosis, can be a painful and debilitating condition. If you're dealing with an ingrown toenail, you're not alone. This guide will provide you with the information you need to understand this condition, and offer advice on how to treat and prevent it. Whether you're looking to treat a current ingrown toenail, or just looking for ways to prevent the condition in the future, this guide has you covered. We'll start with a discussion of what an ingrown toenail is, what causes it, and what the symptoms can look like. We'll then move on to discussing different treatments and remedies, both at home and at the doctor's office. With the help of this guide, you'll be able to take the necessary steps to manage the condition and get back to living life pain-free. What is an ingrown toenail, onychocryptosis? An ingrown toenail is a painful condition caused by a nail growing too far into the toe, causing inflammation. Ingrown toenails are most common in the big toe. They can also happen in the second toe, and occasionally in the third toe as well. The toenail grows into the flesh of the toe instead of pushing the nail forward like normal nails do. Over time, the inflammation from the living tissue can lead to tissue damage, making the nail harder and thicker. If the nail is outside the toe for too long, it can cause pain and swelling. In severe cases, it can even cause tissue damage and infection. An ingrown toenail can be difficult to diagnose. Another nail problem, like a fungal infection or psoriasis, can cause a toenail to appear to be ingrown. Some people also experience pain that feels like an ingrown toenail, even though it's not technically an ingrown toenail. What causes an ingrown toenail? This is a condition that's caused by the nail growing into the toe instead of pushing the nail forward. As the nail grows downward, it pushes the toe tissues upward. Over time, the tissues become irritated, and may start to swell. This is often mistaken for an ingrown toenail. There are a few other causes of ingrown toenails. A toenail on one foot may be pushed upward, leading it to grow upward as well. These conditions are usually more severe, and cause the toe to swell, redness, and pain. In some cases, an ingrown toenail can be related to diabetes, psoriasis, or a fungal infection. These conditions can cause the toenail to grow too quickly, and push upward instead of forward. Treatment options for an ingrown toenail. At-home remedies. If you don't see any improvement while using these remedies, see a doctor. These can help with minor toe pain and swelling. Apply ice, or a frozen bag of peas, to the toe for 10 minutes every hour. The heat will ease pain and swelling. Apply an ice pack, or a frozen bag of peas, to the toe for 20 minutes every hour. This will also help ease pain and swelling. Apply an anti-inflammatory ointment, like Tiger Balm, to the toe every 2 hours to help relieve pain. Anti-inflammatory drugs can reduce inflammation, which may help with pain. Elevate the foot by placing it in a pillowcase or elevating it with pillows for 20 minutes every hour. This reduces swelling, and will also help ease pain. Use a pair of socks that restrict toe movement. This will help with toe pain and swelling by restricting movement. Apply a compression sock, like the compression socks offered by Footwise, to the toe with a compression sock every 2 hours. This will help reduce swelling, and ease pain. At-home remedies. Apply an ice pack, or a frozen bag of peas, to the toe for 20 minutes every hour. This will help ease pain and swelling. Apply an anti-inflammatory ointment, like Tiger Balm, to the toe every 2 hours to help relieve pain. Anti-inflammatory drugs can reduce inflammation, which may help with pain. Elevate the foot by placing it in a pillowcase or elevating it with pillows for 20 minutes every hour. This reduces swelling, and will also help ease pain. Use a pair of socks that restrict toe movement. This will help with toe pain and swelling by restricting movement. Professional treatments. Laser treatments. Laser treatments can be used to treat a toe with an ingrown nail. They are FDA approved, and are an effective option for minor ingrown toenail conditions. Simple over-the-counter pain medication. If you don't see any improvement while using these remedies, see a doctor. Surgery. Surgery is an option for severe cases of an ingrown toenail. It can remove the ingrown nail and trim the toenail at the same time. In some cases, surgery is the only option. Toenail debridement. This is when a doctor removes the ingrown toenail and just the surrounding area of the nail. This can be done in a doctor's office, or at the emergency room. Nail fungus. Nail fungus is a common fungus that can cause an ingrown toenail. It is usually treated with antifungal creams, but sometimes surgery is needed. Prevention tips for an ingrown toenail. Apply foot powder to your toenails and between your toes daily to help prevent infection. Wear shoes that fit well, and wear socks that fit properly. These will prevent your toenails from turning in and rubbing against the shoe. Wear shoes while walking or jogging. This will help prevent your foot from turning in. Don't wear old, worn-out shoes or sandals. These can cause your feet to turn in, and can cause an ingrown toenail. When to see a doctor. If the condition persists past 2 weeks. If the condition persists after treatment. If the condition causes great pain or swelling. How to care for your feet. Change your socks regularly. This will help wash away dirty socks and keep bacteria out of your toenails. Wear clean, dry socks. These socks should be rolled up tight and not worn down. Keep your toenails trimmed. These toenails are more prone to ingrown nails, so trimming your toenails short can help prevent ingrown nails. Don't walk in heels. Heels can cause your feet to turn in and can cause an ingrown toenail. Use a foot file or callus remover to help keep your toenails short and smooth. Take daily foot and ankle baths and use a foot cream to keep your feet smooth and soft. Don't wear open-toed shoes when you're not wearing your sandals. These shoes can cause your toenails to turn in and become ingrown nails.